you're acting responsibly.
We all know, for example, that a significant number of patients with Parkinson's disease do become demented, although the exact number is somewhat debated in the literature right now. I think you can expect that 15 to 20% of patients will be demented, and with that have a drop in intellectual capacity, intellectual function. But here there's almost a superimposed problem, and I think at first point, the first management issue is to try to decide what the diagnosis is. If the patient is truly demented, then there's probably little you can do to correct or change his intellectual impairment. However, the delirium is one aspect of this that you might be able to help. Now, in my own mind, I try to separate delirium from dementia primarily by the patient's state of awareness. For example, in the DSM-3, the Diagnostic Statistical Manual of Mental Disorders, they often differentiate dementia from delirium primarily by the level of consciousness and the state of alertness of the patient. For example, they suggest not making a diagnosis of dementia in someone who has an alteration in consciousness. Whereas they define delirium as a florid state, often with delusions, hallucinations, but not always, and often occurring in the presence of an altered level of consciousness. The reason I think this is so important, as you might guess, is that delirium is often drug-induced, and I don't think there's a drug yet used in the management of Parkinson's disease that hasn't at one time been associated with delirium. In the people who fail on tricyclics, I think electroconvulsive therapy is often indicated. And I think you have to be careful. You have to tell the family what they can expect. It will temporarily help the depression. Depression may recur. 2 or 3 of the psychiatrists at our institution are using ECT, and then they put a patient on maintenance imipramine, and they seem to think that helps. My small amount of experience with that also indicates that it's effective.
I think there's a medical reason for the drop in standards.
Well, not medical, exactly. Her son, I saw bruises on his back.
You've been beaten?
I don't know. I was concerned.
If there's a problem that needs to be dealt with, and Alman has a trained for just that kind of social care. You're not telling tales.